Hey there, welcome back. We've got a fascinating deep dive set up just for you today, all about anabolic steroids. Now, you might think this is just about bulking up at the gym, but trust me, this goes way beyond athletes. We're going to uncover a hidden world, the history, the societal pressures, the serious health risks, and even the surprising ways addiction can take hold.
What's really intriguing is that we're essentially talking about synthetic versions of testosterone. You know, that hormone we typically associate with things like male puberty and muscle growth. But these synthetic steroids crank things up to a whole new level, affecting not just muscles, but mood, aggression, even how your body stores fat.
I've always heard these street names like gear, juice, roids. It definitely makes you realize this isn't just a textbook topic. But before we get into the misuse, what about the legitimate uses? I know doctors prescribe steroids sometimes.
You're right. There are valid medical reasons for using steroids. For instance, they can be prescribed for conditions like delayed puberty or muscle wasting diseases. The key difference lies in the dosage and supervision. Medical use involves carefully controlled doses and monitoring by healthcare professionals.
So let's dive into that world of misuse where things get a little more complicated. Where do we even begin with a topic like this?
Well, the history of doping in sports goes back further than you might imagine, over a century, in fact. Can you believe that in the early 1900s, athletes openly talked about using performance-enhancing substances? There were no rules against it. It wasn't until 1935 that we even saw the synthesis of testosterone, which really marked a turning point.
That's wild. It seems like things started to shift when the Olympic Committee introduced drug testing in 1969. Was that a sign that people were starting to question the ethics of it all?
Absolutely. The introduction of drug testing reflects a growing awareness of fairness in competition. But by 1990, the problem had escalated to the point where the U.S. Congress passed the Anabolic Steroid Control Act, classifying them as Schedule III controlled substances. This put them in the same category as drugs like ketamine and anabolic steroids, highlighting the potential for abuse and dependence.
That's a pretty serious categorization, putting them alongside drugs with known risks. And here's something that really surprised me. It's not just athletes using these substances.
You're right, that's a common misconception. Research suggests that the majority of anabolic steroid users are actually non-athletes, often driven by concerns about their appearance.
It makes you wonder about the pressures we face to conform to certain body ideals. And you mentioned something earlier called muscle dysmorphia, right?
Yes. Muscle dysmorphia is a type of body image disorder where individuals become fixated on the idea that they're not muscular enough, even if they are objectively very muscular. It's like a distorted self-perception where the mirror doesn't reflect reality. This condition can fuel the misuse of steroids as individuals try to achieve an unattainable physique.
So how are these steroids actually used? I imagine there are different methods. And I'm guessing the dosage plays a huge role in whether it's considered misuse or legitimate medical treatment.
You're spot on. Steroids can be administered through various methods: oral pills, injections, even gels and creams. When it comes to misuse, the dosage is a critical factor. We're talking about doses that are often 10 to 100 times higher than what a doctor would prescribe for a medical condition.
That's a massive difference.
Yeah.
Just like comparing a sip of coffee to chugging down the entire pot. No wonder there are serious consequences associated with misuse. But let's get specific. What happens to the body when someone takes these high doses of steroids? I know people talk about roid rage, but is that really a thing or just an exaggeration?
Roid rage isn't just a myth. In the short term, anabolic steroids can significantly impact mood and behavior. They can lead to increased irritability, aggression, and even extreme mood swings. Some individuals experience paranoia or even delusional thinking. And here's the truly concerning part. Steroids can impair judgment, so individuals might not recognize how their behavior is changing.
Wow, that does sound intense. And I'm guessing the long-term effects are even more worrisome.
Unfortunately, yes. Prolonged misuse of anabolic steroids can have a devastating impact on the body. With many of the consequences being irreversible, we're talking about serious damage to vital organs like the liver and kidneys.
Hold on, serious damage. Can you give us some
What?
specifics? What exactly happens to these organs?
Of course. High doses of anabolic steroids over time can lead to a condition called cholestasis, where bile flow from the liver is blocked, leading to potential liver failure. And in the kidneys, they can disrupt the delicate filtering system, potentially causing a type of scarring known as glomerulosclerosis, which impairs kidney function.
This is definitely painting a much darker picture than the typical get big quick image associated with steroids. What other long-term effects should we be aware of?
Another major concern is the impact on the cardiovascular system. Anabolic steroids can lead to an enlarged heart, a condition known as cardiac hypertrophy, which can increase the risk of heart failure. They also disrupt cholesterol levels, specifically increasing the bad LDL cholesterol and decreasing the good HDL cholesterol. This imbalance significantly raises the risk of atherosclerosis, the buildup of plaque in the arteries, setting the stage for heart attacks and strokes. And it's important to note that these cardiovascular risks aren't limited to older individuals. We're seeing these complications in young people who misuse steroids.
That's incredibly alarming. It's clear these substances have far-reaching consequences that extend far beyond building muscles. But we've been talking about the body as a whole. Are there any gender-specific effects that we should highlight?
Yes, there are several important differences in how anabolic steroids affect men and women. Would you like to delve into those now?
Absolutely. This is the kind of information that I think a lot of people might not be aware of. I'm ready to hear more.
Let's start with men. One of the more notable side effects is testicular atrophy, where the testicles actually shrink in size. This can be accompanied by a decrease in sperm production, leading to potential fertility issues.
Wow, that's not something you hear about every day. What about women? I'm guessing the hormonal effects would be quite different.
Indeed. For women, anabolic steroid use can lead to masculinizing effects. These can include a deepening of the voice, excessive hair growth, particularly facial hair, and irregular menstrual cycles.
So we're talking about some pretty significant physical and hormonal shifts for both sexes. And what about teenagers who are still growing and developing? Are there specific risks for them?
That's a critical point. If teenagers use anabolic steroids before their bones have finished growing, it can actually stunt their growth. Steroids can prematurely close the growth plates, leading to shorter stature than they might have otherwise achieved.
It's clear that the potential consequences are far-reaching. And it makes you wonder how these substances can be so alluring despite all these risks. I mean, we typically associate addiction with drugs that give you a euphoric high, but I've heard that's not really the case with steroids.
That's an interesting observation. You're right. Anabolic steroids don't directly trigger the reward pathway in the brain the way drugs like cocaine or heroin do. They don't produce that immediate rush of dopamine, the neurotransmitter associated with pleasure and reward.
So if there's no immediate high, how in the world can they be addictive? That seems counterintuitive.
It's a fascinating paradox. While steroids might not trigger a classic high, they can still lead to a substance use disorder, which is the clinical term for addiction. This happens because the changes induced by steroids, particularly the increase in muscle mass and strength, can become very reinforcing for some individuals.
So it's less about chasing a feeling and more about achieving a desired physical state. But how does that turn into an addiction?
Well, imagine you're someone who has always struggled with feeling weak or inadequate. Suddenly, you start using steroids and you see a dramatic transformation in your body. You feel stronger, more powerful, more confident. Those changes can become extremely addictive, even if there's no initial euphoric rush.
It's almost like they're hooked on the results rather than the substance itself. But even with that, wouldn't most people stop if they started experiencing negative consequences?
You would think so, wouldn't you? But that's the hallmark of addiction. People continue to use the substance despite experiencing significant harm physically, psychologically, financially, even in their relationships.
And with steroids, I imagine those negative consequences can be pretty severe, given all the health risks we've discussed.
Absolutely. We're talking about potential organ damage, hormonal disruptions, and even psychiatric problems. And what's even more alarming is that some individuals who develop a dependence on steroids will turn to other drugs, like opioids, to manage the side effects. For example, they might use painkillers to cope with joint pain or sleep aids to combat insomnia.
So they're essentially compounding the risks by adding more substances into the mix. It's a dangerous cycle. This whole discussion has been really eye-opening. We've uncovered so much more to this topic than just the simple idea of building muscles. It makes you realize that steroid use isn't just an individual issue. There are broader societal implications as well.
You've hit upon a crucial point. The prevalence of steroid use reflects, in many ways, our society's obsession with physical perfection.
It's like we're bombarded with images of ideal bodies in the media, and it creates this pressure to achieve an often unattainable standard. And then you have these substances that promise a shortcut to those results.
Precisely. And this raises important ethical questions. What message does it send when we prioritize achieving success, whether in sports or in appearance at any cost? How does it impact the integrity of competition and the value of hard work and natural talent?
It's a complex issue with no easy answers. But I think having these conversations is crucial for raising awareness and promoting a more nuanced understanding of the topic. This deep dive has been incredibly informative. We've gone beyond the surface and really explored the history, the science, the psychological and societal factors surrounding steroid use.
We've only just scratched the surface. There's a wealth of information out there for anyone who wants to delve deeper into this topic. We'll be sure to include links to additional resources in the show notes.
I encourage everyone listening to check those out and continue exploring this complex issue. But before we wrap up, I want to leave you with something to think about. Knowing everything we've discussed today, where do you stand on this issue? Do you think steroid use is a purely personal choice? Or is there a collective responsibility to try to prevent harm and promote ethical behavior, especially when it comes to things like professional sports?
That's a great question to leave our listener with. It's a complex issue with no easy answers, but I think it highlights the importance of having open and honest conversations about the pressures we face, the choices we make, and the values we prioritize as individuals and as a society.
This deep dive has definitely given me a lot to think about, and I hope it's done the same for you. Remember, this is just the beginning of the exploration. There's always more to learn. And we encourage you to keep digging deeper into this topic or any other topic that sparks your curiosity.
Absolutely. Stay curious and keep those brains buzzing.
And until next time, happy learning, everyone.